Hi, everyone. I'm Lisa Ann Landry, Senior Health Insurance Agent, here today to explain how the Secure Advantage plan works. What you're seeing here is a health coverage summary. You should get one of these with any quote that you get for health insurance, and you will have the quote listed right above the red line that says Secure Advantage. It'll be up on the right. This does not have a quote on it because the premium depends upon your age, your zip code, and then the number of people that are on the plan. So this is just a sample of all the things, some of the things that you could get in your quote. The PDF file is called a health coverage summary. It's an interactive PDF file. The blue buttons are clickable. So you could click on the blue buttons and get popular plan features or plan brochures to get more details. It's, like I said, an interactive PDF file. So we're going to be going through the various sections so you can understand how the plan works. At the top left, you can see that the underwriter is Freedom Life Insurance Company of America. That's a United Healthcare company, and they subscribe to the United Healthcare Choice Plus PPO network for this plan. That's a nationwide PPO. That means you could go to any doctor, any hospital, anywhere in the US. If you stay in network, you'll get a 30 to 60% discount on your services, and then your plan pays a benefit after that discount. So that's what I'm going to be showing you. In the first section, where you see Secure Advantage, define sickness, illness, and accident PPO, I'm going to skip past that and first talk about the Secure Advantage Health and Wellness Plus. So these benefits provide outpatient and wellness benefits without you first having to meet a calendar year deductible. I love this plan because these benefits are what people will commonly use, but on any other plan, you would have to meet a deductible and pay a copay, not on this plan. So I'm going to click on the button that says Secure Advantage Health and Wellness Plus Brochure, and that's going to enable me to show you page all 17 of the plan brochure, where you see a side-by-side comparison of plan 1, 2, and 3. The numbers that you see in the columns is what your plan pays for your service after your PPO discount has been applied. I recommend Plan 3 to my clients who are older and who are eligible for things like PSA tests, colonoscopy, because the plan pays the highest level benefit. For my younger clients in their 20s and 30s who never go to the doctor, I might recommend Plan 1 to them. For young families, maybe Plan 2, but you get to decide, so it's negotiable. So I'm going to recommend Plan 3, and then I'm going to show you all 3 plan levels and ask you if you agree that Plan 3 is the best option for you, or do you prefer Plan 2? So difference in pricing from one to the other is about $7 to $10 per person, each level up. So your outpatient benefits on the Secure Advantage Health and Wellness Plus plan are immediately available. You have no deductible or copay to satisfy as long as you stay in network. On Plan 3, each person on the policy is allocated 5 doctor visits a year. If you don't use all those doctor visits, they're just going to roll over to the next year. I do want you to notice that in all these columns, never do you see the word free. So some of my clients, after I explain this whole policy to them, they'll use the policy, call me and say, well, I had to pay $20 after my doctor visit. Okay, I get that. Why? Because let's say you go to the doctor because you're feeling sick. Let's say the doctor visit costs $200. Then they apply the PPO discount and it brings the doctor visit down to $125. Your plan pays $100 toward the doctor visit. So that's why you may owe $25. Anything that is left over after the PPO discount and the plan benefit, that is what you will pay. This Plan 3 also provides you with prescription medication coverage. It provides the highest level of prescription medication coverage. Healthy people don't take prescriptions, so $1,000 a year is way more than what they need. That's one reason why they might drop down plan levels. You can see generic prescriptions, $10 or less is free, and name brand prescriptions, $50 or less is free. And then each person on the policy gets 3 days of diagnostic labs. You get benefits for 3 days of diagnostic x-rays. And 3 days, people ask about, well, what does that mean, 3 days? Okay, well, in January, you're sick and you need some diagnostic labs. But then let's say in August, you're sick again and you need diagnostic labs again. So that's 2 days so far. So that's what that means. And then just want you to know that your plan does have benefits for emergency, but you should avoid going to emergency unless you're about to die. So go to urgent care instead. And then every year you have, each person on the policy has benefits for one urgent care visit a year. The policy also provides benefits to see the chiropractor. So there's 5 chiropractic visits. What I love is even if your chiropractor doesn't take a PPO, you could still use the benefit. You pay cash to the chiropractor, submit your receipt for reimbursement. Your policy will reimburse you up to $100 for chiropractic care. In most states, after you've had your policy for 30 days, your wellness benefits apply. So remember, your outpatient benefits are immediately available. And then most states, 30 days after you've had the policy, your wellness benefits apply. I have had clients who went and got wellness benefits right away, and the policy doesn't pay any benefits for wellness if you get it before you've had the policy for 30 days. On Plan 3, in all plans, every year you have benefits for the physical, labs, your children have routine immunizations, pap smear mammogram, PSA test, colonoscopy, and everything else after PSA test. Those benefits are available when you become old enough. So that's 50 or older. And then the way this portion of your policy works, if you go get a physical and after the PPO discount, that physical ends up being $100. Your plan pays $200 for the physical. So they're going to send the doctor a check for $100. They'll send you a check for whatever's left over. So whenever you use your wellness benefits, after the PPO discount has been applied and your plan benefits have been applied, if there's anything left over after that, they'll send you a check for whatever's left over. So this is your wellness and outpatient benefits. Now let's talk about the Secure Advantage Defined Sickness, Illness, and Accident PPO. This portion of your policy will come into play when you have more major medical issues where you will have a deductible to meet. So I'm going to click on the popular plan features to show you the options. And this part is negotiable. So what I do most of the time is pick the options for my clients and then show them this so they know they can choose something else. So if, let's say you were in the hospital for a week or a month, or you have some bad accident, or you need some major medical services, then you're going to have to meet a deductible. As long as you stay in network, your deductible options are $5,000, $7,500, or $10,000. Most of my clients go with the $5,000 deductible that I recommend. But I do have clients that say, I have a lot of money, I have a lot of money saved up. I don't want to pay a high premium. I'd rather have a high deductible. So they'll go for the $10,000 deductible. Then you also have the option on coinsurance. So once you meet the deductible, then the company will pay either 80% of the bill, 70%, or 60%. Whichever you choose is going to influence your out-of-pocket max. So most of the time I choose for my clients the 80% coinsurance. That means the insurance company is going to pay 80% of the bill. You'll pay 20% until you reach a max out of pocket of $2,000. So $5,000 and $2,000 is $7,000. So once you meet that deductible, you have unlimited medical benefits for the rest of the year. And your rate is a guaranteed rate to stay the same for 12 months. The accident protection is the same. So there you have different options for the deductible. Usually for my clients, I just choose the $5,000 deductible. The coinsurance is 80% until you reach a max out of pocket of $2,000. You could choose a 70% coinsurance. That will require your out of pocket max to be $6,000. If you pick 60% coinsurance, your out of pocket max is $10,000. So I feel like $2,000 is more affordable for most people. So I usually recommend the 80% coinsurance. Then from there, you have unlimited medical benefits for the rest of the policy year. Hospital care, emergency services, ambulance, outpatient prescription for bodily injury, surgery, therapy, laboratory, and diagnostic tests. This URL that you see at the top right, this is something that you could click on and put your zip code in. You put the PPO you have, whether it's United or private healthcare systems, and then put your zip code, and then you could search for a provider. You could search for a hospital, a doctor, or a facility that's in network, and you'll get a list of all of the facilities that take that PPO in the zip code that you put in. Now, it's usually around this time that I tell my clients that private plans are excellent plans for healthy people, but they do not cover everything. So this policy does not cover pregnancy or any reproductive services. It does not include mental health services or drug rehabilitation services. And then I try to write the plan in such a way, if you become critically ill, you're going to have to meet this deductible, the $7,000 deductible. So I try to write the plan in such a way that if you become critically ill with some life-threatening disease, you'll get paid out a lump sum that's enough to cover that deductible. And then I also write the plan in such a way that if you have an accident, anybody has an accident, you have enough accident protection to cover the accident deductible as well. So I want to show you that. In this section that says MedGuard. MedGuard is a critical illness lump sum benefit that pays out for critical illness. It's a 5-year renewable term life benefit with a death benefit. If I'm going to click on the popular plan features so that you can see what it pays out for. And I want to remind you that I ran this sample quote for the state of Georgia. So some states are slightly different in terms of what it pays out for, but you can see it's a 5-year term life insurance with an accelerated death benefit. Some of the reasons why it's highly recommended is because both men and women have a 1 in 3 lifetime risk of getting cancer. There are 15.5 million cancer survivors in the US. There are over 790,000 heart attacks occur each year. That's 1 every 40 seconds. And about 795,000 Americans will have a stroke this year. That's 1 every 40 seconds. So this policy will pay out 100% of the death, 100% of the benefit for life-threatening cancer, heart attack, stroke, kidney failure, major organ transplant, permanent paralysis, terminal illness, aortic graft surgery, coronary artery bypass surgery, heart valve surgery, and coronary angioplasty. If you should pass, that lump sum will be paid to a beneficiary that you name in the application. If you have any of these issues in the first 90 days of having the policy, it's only going to pay out $500. So that benefit can be anywhere from $10,000 to $99,000. Dental and vision. These two are optional. So you can get one or the other, both or neither if you don't want them. With the secure dental plan, there are 3 dental PPOs. There is Dentamax, there's Carrington, and there's the Benefits Options National Providers PPO 360. It's some crazy name. It's United. And then there are 3 plan levels to choose from. So I'm going to show you the secure dental brochure so that you can see all 3 plan levels. Most people in good dental health will choose the Saver Plus plan. I recommend the premium plan, but my recommendations are optional. So you would decide what works best for you. For a young family with kids, the premium plan is the best. For the single person who's in good dental health, the Saver Plus plan is great. But the Saver plan, I don't recommend it to anybody, because look at how much dental benefits you have a year. $500 doesn't cover anything. So on the premium plan, the dental benefits, the annual benefit per person is $1,500. The orthodontic benefit is $400. The lifetime benefit for orthodontic is $1,000. So if you stay in network for your services, the preventive care is covered 100%. There's no waiting period or deductible to satisfy. And if you look at the bottom of page 2, you'll see what's included with preventive care: 2 free cleanings a year, bite wings and x-rays once a year. For children under 14, you also get topical fluoride, topical sealant, and space savers, and so on. And then once you start using basic care and major care, you'll have a $50 deductible if it's a policy for a single person, $150 family deductible. Basic care and major care and orthodontic care have waiting periods. In Georgia, the waiting period is 6 months. In all other states, major care and orthodontic care has a 12-month waiting period. So that's what that footnote is saying next to those 3 things. Basic care is covered 80%. And if you look at the bottom right of page 2, you'll see what's included with basic care: general anesthesia, fillings, simple tooth extractions, non-routine x-rays, and so on. And then major care is covered 70%, so is orthodontic care. And if you scroll down to the bottom of page 3 and look on the left, you'll see what's included with major care: multiple fillings, single crown restoration, dentures, partial dentures, periodontic scaling, surgical extractions, and implants, and so on. And then on the right, you'll see what's included with orthodontic care. It's a long list of stuff. I don't know what it is, but I kind of feel like if you need it, you'll recognize it. So the premium plan is a great option if you're going to have a lot of dental work. If you're in good dental health, the Saver Plus plan works fine for most people. Just note there's no orthodontic care. It's only provided with preferred dentists, and it's at a discount. And now talk about the vision plan. So the PPO for vision in most states is the Spectera Eye Network, and the Carolinas is iMed, excuse me. And I'm gonna click on the popular plan features so that you can see what comes with the vision plan. With vision, there's certain things that you can only get at the time of application. You can only get life insurance at the time of application. You can only get vision at the time of application. So it's really worth it though, because with the vision plan, you get 1 free eye exam every year, and you get $120 allocated toward contact lenses or frames. And then Spectera gives you an additional 30% discount off of a balance of $43 or more. And you will have a copay for your lenses and frames, and it's a $10 copay. Thing I want to talk about is the association membership. Most of all the plans come with a membership to the American Independent Business Coalition, and they're different membership levels. I recommend to my clients the executive diamond level or the diamond level. This gives you additional medical benefits that work in conjunction with your Secure Advantage plan. So it really saves you money. So I'm going to tell you how. So at the table of contents, you'll see that the association provides you with personal and professional benefits. You may or may not care about them. They're offered at discounts, but your health and well-being benefits are included in the policy. So one of the benefits that you get is with MD Live, and that's on page 28. So MD Live gives you unlimited doctor visits by phone, video, or app. The association benefits cover everybody in the household, whether they're on the policy or not, whether they're covered on Secure Advantage or not. So one of the things I recommend is before you use your in-person doctor visits, call MD Live first. They'll take your symptoms. They'll provide a prescription if you need one. If you look on this next page, 29, you'll see common health issues that MD Live treats people for. So use MD Live first. And if you remember, Secure Advantage does not provide reproductive services or maternity. It does not provide benefits for drug rehabilitation services or mental health services. MD Live does. So each person gets 3 free behavioral health visits through MD Live every year. If you want to meet more frequently than that, it's $90 an hour. Accidental death and dismemberment benefits. And those benefits are on page number 20. So some people say, well, I don't need that. Can you take it off? No, this is all built into the association membership. So each member gets accidental death and dismemberment benefits. The primary member gets $60,000 benefit, the spouse $30,000, and each of the kids $15,000. And then you have benefits for loss of use of limb and things like that. Down at the bottom where you see excess medical expense coverage, that's accident protection. It covers everyone for any kind of accident they may have on or off the job. So you would use this portion of your policy to make a claim if you have an accident. You have a $500 deductible and you have $10,000 of medical benefits. That $10,000 is enough to cover the $7,000 deductible on Secure Advantage. So let's do an example. Let's say that there was a guy who got bit by a rattlesnake. And he ended up with $168,000 of medical bills over that rattlesnake bite. So with all those medical bills, you know he's going to have to meet the deductible. The deductible $5,000 out of pocket max $2,000. So he had MedGuard, but MedGuard pays out for critical illness. It won't cover a rattlesnake bite. That's an accident. So he made a claim and paid the $500 deductible here. And he used the $10,000 of medical benefits from this to cover the deductible on Secure Advantage. Once you cover the deductible and you meet your out-of-pocket max, your medical is covered 100% for the rest of the year, the rest of the policy year. So $168,000 of his medical bills were covered once he met the deductible, and the premium stayed the same. I love this plan. I highly recommend it. I recommend it over our other plans because it's so good. Once you meet that deductible, your medical is covered 100%, and you get to keep this plan until you're eligible for Medicare. Remember, a private plan you can cancel anytime. This is the best plan that we have. It also includes excess hospital room and board benefits. So anytime anyone goes in the hospital for sickness or accident, there's a 1-day elimination period, but then this portion of your policy will provide you up to $800 a day, up to 30 days, every time someone goes in the hospital for sickness or accident until you use up $1 million worth of stays. So let's do an example. Let's say that you get sick and you're in the hospital for 11 days. There's a 1-day elimination period, so you'd have to pay that 1 day. But you could file a claim for the other 10 days, and this portion of your policy will provide you with $8,000. That's enough to cover your deductible and your out-of-pocket max on Secure Advantage. Remember, the deductible is $5,000, the out-of-pocket max is $2,000 without you having to cover that. So there are a lot more details in the brochure, but that's everything in this health coverage summary that I wanted to go over with you. My name is Lisa Landry. I'm a senior health insurance agent. I'd love to work with you. If you work with me, you should know what to expect. I'm going to ask you a whole bunch of questions like your date of birth, your height and weight. I'll ask for a list of pre-existing conditions and any prescriptions that you take. I may also ask you what your estimated household income is for the year that we're doing work together, so I can see if you qualify for subsidy on the public market. I'm going to research all of your options on the public and private market. I'll email you rates with recommendations, and then I'm going to call you and explain everything so that you can decide what's going to work best for you. I'm available Monday through Sunday, 8 a.m. to 10 p.m. Eastern Standard Time. I'm delighted to help you. I'm licensed in 32 states, so call me. Thank you for your time. Bye.